hit the record button. And so, hi everyone, I'm Lynn Kenny with the Center for Health Design. Welcome, I'm so glad you're joining us for our October Affiliate Connections call. We will ask that everyone stay muted just to cut back on any background noise. And I'm going to do a few introductory slides here, and then I'm going to turn it over to our guest speakers for our session today. So we do have a wonderful session that we'll be able to share with you, a case study from Vincentian with Patty Embry and Michelle Bulger. And we'll have them present, and then we'll have some Q&A, and then I'm going to share some of the most recent resources with you. So we already mentioned we'd like to have you stay on mute. Please close any unnecessary windows on your computer. That will help with the bandwidth. I think for now, we'll ask that everybody keep their camera off so that we can focus on the presenters, and then when we go to Q&A, turn your camera on if you're comfortable. That way we'll know who's asking the question, and if we want to have you speak, if you have a question and you'd like to speak with the presenters, we can unmute you. And then you can always use the chat to ask any questions. And then if your audio for some reason isn't working well, you can always, in the invite, there's a call-in number. You can use your phone for the audio portion. So the call will be recorded today. You'll be able to access it after the call on the members only page on the center's website. If you have trouble finding it, just email me. And of course, you can access all previously recorded affiliate connection calls from that site as well. And then I think at this point in time, we created this slide to kind of help optimize your screen viewing. But I think we're all spending all day, every day on our Zoom calls, so you probably already know this, but you do have the ability to change the way you're viewing the slides, and you can minimize the window of the folks that are presenting or talking. I told you about the members only page, where that's where we'll house the recording of this. And so without further ado, I'm going to say we're going to introduce our speakers for today. We're very honored and excited to have Patty Embry and Michelle Bulger presenting. They're from Vincentian, and let me tell you a little bit about each of the speakers, and then they're going to share their case study with us as they developed their COVID-19 unit, and a little bit about the intergenerational program. Patty is the Chief Operating Officer and Vice President of Innovation at Vincentian Collaborative System. She calls upon 25 plus years of healthcare experience in areas of nursing and leadership, IT, quality and process improvement, as well as patient-centered design, to strategize innovative improvements that benefit organizational growth, staff and resident engagement, and sustainable culture change. She has been a featured speaker at Leading Age, AADNS, IHI Health National and International Forums, as well as the Beryl Institute. Michelle leads program development and person-centered design at Vincentian Collaborative System, and also has more than 25 years of experience in healthcare, serving in patient access, finance, customer service management, and training and development. She has been a featured speaker also at Leading Age, IHI National Forums, Altogether Better Health, the National Patient Safety Congress, as well as the American Organization of Nurse Executives. So, Michelle and Patty, thank you so much for being with us today, and I'm going to turn the screen over to you. Michelle, you can start sharing your screen whenever. Thanks.
Sorry. There we go.
Just a reminder for anyone who's come in recently, if you wouldn't mind putting your speaker on mute, that will help a lot during the presentation.
Right. All right. Well, thank you very much for that lovely introduction. We are very excited to be here today. And I'm going to start by telling you a little bit about us and what we do and what our approach is. And then we'll kick into some of our projects. And we will tell you about some of the things we're doing. That sound good?
Okay. Perfect. Thank you.
All right. Vincentian is a Catholic not-for-profit healthcare and human services organization. We do offer a continuum of care for more than 2,000 seniors per year. And we are a CCRC, Continuing Care Retirement Community. And we do offer pretty much everything from independent living, personal care, memory care, short-term rehab, skilled nursing. More than that, we also cover the full circle of life, if you want to think about it that way, because we have childcare too. So really, Vincentian can be with you for the entire journey. We do it all. We are located in Pittsburgh, and we have facilities that are accessible to most areas of the city. And as such, we do have a very diverse workforce, and we serve a diverse client base as well. Today, we're excited to be here to tell you, about who we are and what we're doing, because we're always excited to share and learn new things. Here's our stat sheet here. And Vincentian is pretty established in our community. We have been here, I'm excited to say, almost 100 years. Some of our facilities joined Vincentian through acquisitions and partnerships, and some were established from the ground up. So we do have the shiny and new, but then we have the more classic models with add-ons and modifications. But no matter what, all of our facilities are completely committed to reaching high for our quality stars and providing the high quality care and the best possible resident experiences to everyone we serve. And you can see we have three skilled nursing facilities, 3 personal care homes, 2 independent livings, and then 2 child care centers as well. We have about 800 employees. We do have a rich history, and we have a lot of respect in the community. Like any organization that's been part of the community for many years, we do say the word tradition with reverence, but we also say it with caution. One of our strengths is that we see our tradition as strong roots to respect, but we don't let them hold us back because our roots are not restrictive. They do give us the foundation to grow. It's our willingness to grow and evolve in order to meet the changing needs of our industry while not losing sight of who we are. It's really what sustained us, and it's been integral to our success in our industry. So Vincentian is rooted in the work of St. Vincent de Paul. You may have guessed that, in St. Louis de Marillac. And they were caring for the sick and the poor in 17th century France. And their work expanded and continued, throughout the next hundreds of years. And so let's fast forward to the early 1900s, and 5 Vincentian sisters were called to come to Pittsburgh, the Braddock section of Pittsburgh, actually, to care for the children of steel workers at the Edgar Thomson Mill. So nuns made a pilgrimage to a steel mill. If that's not a Pittsburgh story, I don't know what is. So they established themselves there and did their work and took care of their business. And then a few years later, they wanted to, again, put down more roots, and they bought a plot of land in the North Hills of Pittsburgh and continued their work there. That is our North Campus now. We still are on that same spot, and we've expanded and developed it and everything like that. And they started with the Rosary Cottage, where they began their foray into healthcare, caring for the sick and the poor in that community. So an organization's mission is really the goal of what they're trying to do, and ours is no different. And it's to provide compassionate care and preserve the dignity of the people we serve in a diverse and changing society. So the values are definitely the tools that we use to achieve our mission. And our mission and values are rooted in our traditions, of course, but if we do take a lesson from St. Vincent, his work didn't stand still. It evolved, and he innovated. And you still hear his name today with DePaul University, St. Vincent College, the St. Vincent de Paul Society, Vincentian, like us. It wasn't an accident. Well, we took a look at our values, and we did this a few years back when our current leadership team of Nick Vizaka, our CEO, and Patty Embry, our COO, they came on about four or 5 years ago, and realized there was a gap in our values. They were sound, they stood for what we do, but we needed another value, and that was innovation. So we added innovation to the mix. We needed to be nimble, to be forward thinking, and to form the collaborations and partnerships that enable us to move forward successfully. You know, seniors are evolving and senior care is evolving. And considering that none of us really want the same senior experiences that our grandparents did, as an organization, we have to be driving the boat and leading the changes instead of treading the water and bracing for the wave. By adopting innovation as a value, it sets the tone, it equips us, and it sets the course to achieve what we need to be in the future. So changing times requires to be smart and responsive, and the best way to do this is by knowing the needs and wants of your end users. Looking at your services from their point of view, this is a very challenging time for our industry, for them and for us, for many reasons. And tuning into our users' perspective definitely gives us an edge. We can see that seniors are wanting more from us, and while that's happening, we have more challenges to face as well. You know, service excellence is first and foremost in almost every industry now. It's the experience economy, if you will. In our world, people do expect you to be clinically capable, so providing quality care isn't perceived so much as a gift as an entitlement, and rightly so. The experiences we create do, however, need to be above the bar and set us apart. Before, it was us and pretty much the entire healthcare industry determining the level of service. You know, hey, this is how we do things. This is the way we do it here. But now it's a very competitive market, and consumers are informed and empowered, and they want what they want because someone else is gladly going to promise it to them. It's a very competitive market, so we have to stand apart. You know, payment models are changing too. Payment-driven payment models, PDPM. How ready are you if this is, you know, in your world? And how dependent are you on dollars that might not be there? What is your plan? Seniors are very tech savvy now because if you don't meet their expectations, they are definitely going to tweet about it. We all know a senior who tweets, and he could tweet to us too, no doubt. So we do have our work cut out for this new value. We are putting it through its paces, that innovation value, and we are finding ways to innovate the future senior care landscape on both the small and large scale. When you think about innovation, usually right away you think about high tech, and we are about embracing technology, especially to enhance experiences. We have and we do. It just isn't the only tool in the shed, and it isn't the only approach we take. To harken back to St. Vincent again, he was innovative. He had to be to sustain his reputation in his work for nearly 400 years. He didn't have GPS or iPads to help him maintain the schedules of his helpers or the people out there serving the poor, but he got the job done. He looked at things through the eyes of the people he was serving, and it revealed better ways to get things done. And if you do look at things from your resident's perspective or your client's perspective, or your end user's perspective, different opportunities will present themselves. Perspective is powerful, and a client's or resident's or end user's view of things can always spark a powerful innovation that doesn't necessarily plug in, you know? If we stay focused on the needs of our end user and look at things from their perspective, we will see the opportunity to close the gaps from where we are to where we want to be. We have also learned that when we take this approach and focus on making experiences better, by default, we take care of everything else. If we create better experiences from their point of view, our outcomes are shown to get better and our costs go down. Using low-tech and high-tech solutions, they go hand in hand and they both have impact. So now let's talk about how this approach has made a difference to Vincentian. One of the first major projects on the docket when I started here back in 2007 was Terrace Place. Terrace Place is, oh, I don't know why it's doing that. I apologize. Terrace Place is a shiny new independent living facility located on our North Campus. It's about 90 apartments, independent living apartments, and the project was resident focused from the beginning. We took a resident focused approach to design, and we talked to the community, incorporated high and low tech solutions. They are all smart apartments. They have smart technology, so that's on the high end of innovation. Although the building is positioned to maximize the sunlight that comes in there, so that was a more low tech solution that just sort of made sense. We also engaged with the potential residents who actually became the first actual residents from the very beginning. And I was fortunate enough to be the one who conducted some of those pre-arrival interviews with the early residents. You know, we asked them what was important to them. And overwhelmingly, the most important thing was to be part of a community and to be engaged with people who were like-minded and other-minded, and to learn from them and to share what they knew. More than half of the people said that directly. I want to know what people know, I want to learn what they know, and I want to share with them what I know too. And that was pretty impactful. So given the fact that we were designing a community from the beginning, where do we start? Thinking about, you know, what makes the best kind of communities, what makes them good. Think about the communities you're a part of. What do they need to thrive? You know, in thinking and discussing this with my friends and family and my coworkers, the communities which I was most successful in included my family, most of my workplaces, and other groups. And when I thought about the qualities that made these communities good, the potential to have these things at Terrace Place certainly was there, but there was one notable difference, and that was generational diversity. Families do offer this. Families by design have elders and babies, teens and middle-agers, seniors ready for retirement and seniors ready to graduate, and you can't argue that it is a pretty good design. Many, and certainly my workplaces, offer the same thing. We do have more generations in the workplace now, more than ever in history, and yes, that does offer challenges, but there are benefits and perspectives and engagement that are to be gained by that too. So you have all this in the workplace and then you retire. The generational diversity could retire with it. So would it surprise you to hear that the social groups most likely to suffer the negative effects of social isolation are seniors and college students? If you think about it, both of those communities have a tendency to be self-contained. College students spend 4 years with people mostly close to their own age. College towns are full of college age people. Now, there are some cross-pollination, but for the most part, they do self-segregate. Senior facilities and communities are the same thing. If the danger of social isolation is present, maybe getting these groups together is really the answer. And so we looked out our door, and literally there's a university 2 doors down from Terrace Place. And we had already had a bit of a relationship with them. So we started a conversation, and within a few months, we started doing something pretty remarkable that no one near us anywhere was doing. It was pretty cutting edge, and it still is. It's not widespread, and it's something that we are proud of, and it's really working for us. Our first group of students came in at the end of the school year 2019, in the school year 2019, excuse me. 3 students got chosen, and there were beautiful new apartments for them to have for free in exchange for weekly hours of programming with our residents. There were some college requirements too, of course, and we've worked together with La Roche to assure that the program met our needs, met their needs, and would have a positive impact on both the residency and the students as we went forward. So they do a lot of different things. They do cooking demos, lead book clubs, exercise classes, tech demonstrations. We call it apps and abs, where you get a snack and a tech lesson. And everybody seems to love that. In addition to other things, you know, the students have rules, of course, no raging parties, no kegers, nothing like that. But it is their home, and they are able to enjoy it as such. In fact, I'm going to stop talking about it now, and I'm going to let you see it for yourself. So, introduction to the student program at Terrace Place.
Michelle, your video on?
I couldn't quite believe where I heard some local college students were choosing to live and who they were choosing to hang out with. Let me show you. Ricardo Serrano Perez is a senior at La Roche University in the North Hills. He's working toward graduating this spring with an accounting degree while holding down a part-time job at a restaurant and while making time to hang out with his buddies in his building just off campus. Tonight, he's cooking for his friends.
So how are we all doing?
This is Ricardo's crew. They're residents of Terrace Place at Vincentian, a new independent living community for seniors and for some students from nearby La Roche University. Weird, right?
How is it that you've got units here that are occupied by college students? That doesn't seem to make sense.
Doesn't make sense, but it makes sense to us.
Nick Vizaka of Vincentian says the concept has taken hold in the Netherlands, but this is the Pittsburgh area's first intergenerational residency for college students and seniors. But again, why?
The two biggest groups that are affected by social isolation are seniors and college students. College students because they're away from home and depression and they feel isolated, they don't know anybody, and seniors because their kids usually move away. So they don't have the grandkids, they don't have the kids. But when you put the two together, it's instant grandchildren and instant grandparents. So it's chemistry is fantastic.
You ever feel like you're a son or a grandson to them?
Yeah, a couple times, yeah. And it's a good feeling to have someone that cares about you, even though like you just met like 5 months ago.
So here's the deal. In exchange for free rent in one of the very nice apartments here, the students agree to spend at least 6 hours a week with the senior residents. Ricardo loves to cook.
We're gonna be making a vegetable paella.
So he offers cooking demonstrations in the communal kitchen.
Breathe in.
His classmate Natasha Nandwe is into fitness.
Hands on hip for a deeper stretch.
Her twice-a-week Zumba sessions are popular.
Never thought I'd be doing Zumba, but I am, and it's fun.
I feel like they inspire me more than they know. Forward and back.
The staff says it's gratifying to see how the seniors and the students' lives have become intertwined.
I got to tell you, where most students will want to go out on a Friday night or Saturday night, they want to stay in and they want to have that interaction.
Here we go. That's it right there.
Stay in on a Friday or Saturday and do what?
Play cards, chess, checkers, put together a puzzle, watch TV, just a companion to watch TV with.
We've had life experiences that can help them and their younger, faster minds who can certainly help us.
Just sitting down and talking to someone that's older than you for like 15, 20 minutes, you might learn a lot. You don't even know, like the stories and experiences. That's how like the things that we know now gets carried down. It's just people talking about it.
Sure, Ricardo says he does have to keep his music down here, even though he prefers it loud. And no, a kegger in your apartment here would not be cool. He and Natasha don't seem to mind.
I'm spending time finding myself here, being away from everybody, so it's a good experience, and I want more college students to get into it.
You don't feel sad leaving here?
I just love everyone around here, so like I will be sad, but it has been a great experience, and like I'm probably not gonna stop talking about it for the rest of my life, so.
There are 3 LaRoche students living at Terrace Place this year. They're hoping to have 6 next year. And Vincentian says it's going so well that they're now looking at bringing college students into some of their other local senior communities.
Okay, so that is an introduction to Terrace Place, and that's some of the fun stuff that's going on there. Definitely, Ken Rice, the news guy.
I want to tell you about something.
Sorry. Ken Rice, the news guy there, definitely spoke the truth. Good ideas are worth spreading, and we did spread the program to one of our other facilities. So Shenley Gardens at Vincentian is a personal care facility located in the Oakland section of Pittsburgh. If you are thinking about Pittsburgh as a college town, I'm going to ask you to reconsider, because we have about 7 universities in Pittsburgh. And, you know, that's a lot of resources for us. In Oakland, there's a university, Chatham University, and we had established a relationship with Chatham through their occupational therapy program. And it came to light that they were having a housing shortage, and I guess with 7 universities, they would. Coincidentally, we had just acquired Shenley Gardens, and when we acquired it, it was in need of an uplift. It was half empty, and there were a lot of renovations needed. And we had been making great progress with Shenley through 2019, but when Chatham came along and we had partnered with them, we saw an opportunity, and we saw a way to get Chatham's graduate health science students on campus. And that made a good impact on the things we were doing there. There were multiple benefits, programming for residents, the intergenerational interaction, of course. It made a positive impact on the housing shortage. There were designated student areas that we were able to complete a wing for the students, because remember, COVID hit in the middle of all of this while we were getting ready. So we did have to kind of think and innovate on our feet. And so we have a student wing. Their apartments are down one specific hall. There's a specific lounge area that's set up for them. They do get free parking in Oakland. That is a real benefit. That's reason enough to move in. Meal service programs and things like that. And they do have the option to choose their package. The rent is greatly reduced, but you can choose single occupancy if you don't want a roommate, or you can choose to have a roommate at, at a reduced rate. Oh, sorry, went the wrong way. So this is some photos here. This is our student hallway. This is one of the apartments, and that's the student lounge that we built for their specific area. There's some quick shots of it there. So that being said, we are excited about the students, and that program's certainly going to sustain and grow. It's one of the freshest things that's happening in our area as far as intergenerational engagement, and we're kind of proud that we were leaders in that. We are innovating in other ways as well. Remember, low tech and high tech solutions. We are adopting new technology. I told you Terrace Place was full of smart apartments. They are all smart apartments, and we use K4 technology in those buildings, and we are expanding that and seeking to enhance that and potentially move that out to other facilities. We're in the works of doing that now. We're also trying to focus on our staff, growing the Vincentian leaders of the future from inside. We developed a leadership development and mentorship program called Vincentian Rise. That launched 2 years ago. Our risers really set the bar high, and all 3 of them started in more entry-level positions. We had an activities person, a social worker, certainly not entry-level, and an LPN. And all of them have leadership positions now, and they are all thriving and doing very well. And we are, we're taking applications now at launch today, in fact, for the 2nd cohort of Vincentian Rise. We're developing a learning center. We are building a learning center, which isn't really heard of in our industry, so that we can give our staff every tool they need to succeed. We're always evaluating new service lines that keep us nimble and self-sustaining and not relying on government payments. What if you never get another dollar from the government? What are you going to do? Well, we're going to continue. We're going to keep going because we aren't reliant on it. And perhaps most significantly in this moment in time, in 2019, I will credit Patty with that. She had the insight to, shift focus on clinical excellence. And it was very insightful of her, because building a culture of clinical excellence proved to be very timely and very helpful. We knew it was the right thing to do, but we couldn't have known how impactful it would be. So with that, I am going to kick it over to her so she can talk about how clinical excellence really kind of changed the course of what we're doing. So there you go.
Thank you, Michelle. You did a wonderful job presenting our intergenerational programming. I appreciate that. And we will save some time at the end to answer questions about both of these topics. And boy, are we doing a shift from intergenerational programming to clinical excellence and COVID. So hang on, because you're on for the ride. So as Michelle said, I am not a psychic, so I had no idea that the pandemic was coming in early 2019 when we talked about raising the bar at Vincentian as far as our clinical excellence department. But what we did foresee is the fact that our industry did not necessarily have the best reputation for offering the best clinical care. People had a perception of senior care, or post-acute care, or maybe even the long-term care setting of maybe what we provided to your grandparents or your grandparents' grandparents. And I did not want to have that perception anymore in Western Pennsylvania. So we were very, very determined to begin the culture shift and change in our area by now providing the best clinical care that we could at Vincentian and making sure that our area and our market knew that we were taking that extra step to do so. So it was our job to invest in some innovation, some technology, to improve our clinical outcomes, to partner with our acute care facilities. And in our area, the University of Pittsburgh Medical Center, UPMC, and Allegheny Health is a very large medical centers and very prominent in our area. Right now, we used to be steel industry, but we're known as meds and eds, medicine and education. That is what we do in Pittsburgh. So having these types of partners are very, very important to how we will move forward here in our area. So as part of that, we were looking also at our senior population, and we happen to have next to, I believe, Dade County in Florida, one of the largest senior populations in our country. So, we wanted to make sure that what we were delivering was what they expected, because our expectations of the baby boomers coming up are much higher than what anybody has had in the past. So we not only had to deliver great clinical care, but we wanted to raise the expectation for all the experiences that we would be providing for our residents. And we call them residents. And I grew up in acute care, so they were always patients to me. So it took me a little while to transition from patients to residents. So if you hear me slip, they're both one and the same. So our vision for this clinical excellence department was really to first find the visionary, the leader of this particular department, who would set the tone for our clinical teams. What would we be doing to move us forward? And you can go to the next slide, Michelle. So when we first thought about what this department should be made up of and what they should be responsible for, we wanted to make sure that there was excellent clinical programming and quality programming. And that was one of the gaps that I recognized very early on moving into the senior care world, which is something that I recognized was very positive and had great outcomes in acute care setting, but maybe not necessarily was being delivered at the same level in the post-acute world. And that was really providing some good, rich data that tells you where your gaps are. What type of care are you not delivering to the best of your ability? And then develop a program to make sure it meets that. And it just wasn't really happening in post-acute care. So that was really why that is at the very top of my list, because we can't take action and we can't lead if we don't know where our gaps are. We were delivering service excellence. This included process improvement and nurse operations. And in our world, we are measured through CMS, which the STARS rating, which is quality measures, and you're ranked on 3 different areas, and you go up to as far as 5 stars. So it's very difficult at this point in time to be a 5-star facility. And I'm happy to say that we do have 5-star facilities. We have 4 and 5-star facilities, so we're very happy about that. But we also have, I wanted to make sure that we were using good data. So we have partnered with different sources to get the best and most accurate data of what's happening not only in our own industry, but what's happening in the market in general. And then, of course, it's important that we bridge the gap with our partners here in Pittsburgh. We have to understand what our acute care providers are dealing with so that we know when they're being transferred to us from not only a rehab service, which is what we offer a short-term rehab and then a long-term care. We need to understand what is the clinical needs of those residents and how can we transfer them in a continuum of care where there's no worries or no missing orders, medications, and not one beat has been lost as they transfer from one place to another. So with that said, as Michelle mentioned, the timing of this could not be better. And you can only imagine what deep breath I sighed when we were able to get our VP of Clinical Excellence in line before, next slide, thank you, Michelle, before February 29th, 2020. And most of you may not think this is any date that you remember, but this is absolutely a date that I remember. It to me is a 9/11, and where you know exactly what you were doing or when you heard about it, or the space shuttle. It was February 29th, 2020, and I woke up, came down, sat on my sofa, had my cup of coffee, turned on the national news, and heard about COVID coming to the United States. And at that time, I texted my VP of Clinical Excellence, who is now overseeing this department, and I asked her, I'm like, I think it's time that we form a team. Let's get ahead of this virus and not let it get us first. So on that date, that was a Saturday morning. On Monday morning, we formed a COVID command team. Go ahead, Michelle. This team is also known on the inside track as the Cooties team. And we are also sort of like the land of misfits, because it is not the group of people that you would ever put together to drive change or to drive the policy of a pandemic. But I was on that team as the administration representation. There was our VP of Clinical Excellence, We had our director of quality that was on that team, human resources, our communications director, and we had one of our members from the corporate strategy team. So this very small group of people literally acted as the command center team that took in volumes of information and tried to disseminate that across all 6 of our facilities. So in these next couple of slides, and I just put 2 sheets out of the 25 sheets of information that we collected from February 29th. This is a timeline of every action that was taken from this COVID command team to today that implemented change through regulatory bodies or anything that we had to do or act on. Next slide. So I know that you're all familiar with, of course, COVID, but I'm not sure how familiar everybody would be if you're not on the recipient side of the flood of information that comes to you as a healthcare provider. And, for us, every single day, no day excluded, Saturday or Sunday, we were being pounded, I would say, by the hour of information coming down from the Centers of Disease Control, CDC, Centers of Medicare and Medicaid, the CMS, the Pennsylvania Department of Health, who is our regulatory body, who would be the ones who are marching into our building to make sure that we are following good infection prevention, strategies and practices. Our own county health department, and of course our Governor Wolf. So, and others, the city of Pittsburgh, our own townships had mandates. I mean, every single day we were being flooded with either regulatory bodies or mandates or recommendations and everything. And I'm just gonna throw off a couple things off the top of my head of things that happened maybe in the first 7 days from one of these bodies. Just really talking and things that we had to quickly come up with policies, procedures, disseminate the information, and make sure that everybody was communicated to, both residents, staff, families, so that everybody understood that we were all on the same page. So, visitation, of course, we had to stop that immediately when COVID struck. Unfortunately, we could not let families in. We stopped physicians and providers from coming in to see our residents because they also were a source of infection, knowing that they could have been in another facility and brought COVID right into our building. These were mandates coming down for cohorting, symptoms, testing, traveling mandates, return to work, emergency declarations, infection prevention, specimen collection, PPE. I mean, every single hour on the hour, we were responding to this. And the reason I bring this up is because it is so important in a crisis situation to have a team that can disseminate information. And this team also had to digest all of this and come up with a way to lead in innovation and not follow. Next slide, thank you. So what we decided after watching many, many trends and daily, every day in the beginning of COVID-19, we would get on a call with the CDC and listen to what was happening around this country. So with that, we heard the surges that were happening. We heard our overtaxed emergency rooms, our hospitals that were being flooded, what was happening in New York City. And we paused for a second and we thought as a group, let's not wait for this to hit us. Let's take a proactive approach and be ready for it. And if one of our residents would get COVID-19, let's be prepared to care for it. And not only that, let's hope none of our residents ever get COVID-19, and let's be prepared to help our community. So with that, our building, the way that the building was designed, the logistics permitted us to isolate 2 wings. And if you could imagine, there are 2 wings and then 2 wings here, and then the center, they connected with the next extra building. So it was very easy for us to isolate a wing, an entire building, and call that a COVID-19 building. So when we made that decision, we immediately started to call some of our partners, and I'll get into some of those details. And the community at large stepped up. And I would say within 72 hours, we went from having a rehab floor to a specialized COVID-19 unit.
And
So
that,
like
that was
Michelle,
to transform that unit, Patty?
that's
72
exact
hours?
72 hours to transform that unit.
Wow.
So with that, we did receive a lot of media coverage just because the news got out, and we really didn't want it to, because it was a very scary time, and it was something that we didn't want to, it's not the kind of thing you want media coverage for, because it could turn around and slap you right in the face. But for whatever a reason, we were doing a lot of reporting, and you had to have transparent reporting. So news media was calling us every day. How many cases do you have? So they were calling everybody every day to see what your counts were. So when we told them that we did, and you'll hear in the scoop news clip that we accepted 2 external residents from an acute care hospital to our COVID unit, that immediately raised interest to find out more about the COVID unit. And this is the news clip that hit in early April.
Entire wing devoted to caring for COVID-19 patients, even though no residents have the virus. Channel 11 News reporter Mike Holden shows us the extra precautions being taken at Vincentian Home as other care facilities are being hit hard.
A McCandless Senior Living facility is working to keep its staff and patients safe. There are a number of steps in place, and they're focused on helping those who tested positive for the coronavirus get back on their feet.
We did not want to get behind the virus. We wanted to try to stay in front of the virus.
And that has been the mission of staff at Vincentian Home from the beginning. The senior living community just off of McKnight Road has dedicated an entire separate wing to caring for patients who have contracted the coronavirus. The repurposed space is called the COVID-19 Isolation Unit. It is literally separate from the rest of the campus with a set of infection control risk assessment isolation doors. There are even negative pressure air machines that filter the air inside the 14 private room unit so it is not recirculated into the rest of the facility. And a specific team of nurses and nurses' aides only tend to that area.
Now we are completely supplying them with the highest level of PPE. They have P100 masks, gowns, gloves, headdresses, footwear.
Vincentian Home officials confirm no residents in their system have the virus. However, the way that the wing is set up, they are currently caring for 2 positive COVID-19 patients who came from area hospitals outside of the Vincentian facility. Those patients required extended post-recovery care, so they took them into COVID-19 isolation unit, and they will continue to offer that option to other positive patients in the future. Patty Embry, Vincentian Home's Chief Operating Officer and VP of Innovation, is hopeful the pandemic ends soon, but she says they're prepared for whatever lies ahead.
Absolutely. Our intent is to keep the units open. Hopefully, we will not need them in the fall, but just in case, we are listening to the recommendations from the CDC, and we hear what they're saying.
And Vincentian officials say every resident and patient is screened every 8 hours. On top of that, 2 employees are constantly getting assessed. Reporting this evening, Mike Holden, Channel 11 News.
Entire wing.
Okay, so I'm just going to walk through a couple details with you of the development of how we transitioned this in 72 hours, because it had 2 very big components. One was really getting our staff on board, and the other one was understanding what we had to do with the unit itself. So, so the transformation began with really getting staff, because without staff, we would not be able to open the unit. And to do that, we knew we would have a team of people that would step up immediately, but we also had to make sure in this very scary time that they were taken care of. And we were very passionate about making sure that they were cared for. So we did some alterations on their schedules, and we tried to prepare the unit in a way that they would be, it would be safety first and delivering great care. So we moved them to 12-hour shifts, and they were on 3-day rotations. They were on call in that rotation. So if they were off 12 hours, they had 8 hours on call, and then the remaining time of that, they would not be on call. So they were getting paid a majority of the time, even while they were sleeping. So it was financially beneficial for them to be on this team. We had uniform scrub service come in, so that when they entered into the COVID unit, they would immediately change into scrubs. And then when they left the COVID unit, they would remove those scrubs and go back into their lay clothes. We fit tested them with P100 masks. So those are greater quality than N95s, which I'm sure most of you all know that on this call. And then, of course, we had gowns, gloves, shoe and head coverings for them. We had a dedicated entrance and exit, so they would never cross any other person in our facilities. So they had a very isolated area that they came across. So if there was an outbreak, of which early on we didn't know how this would behave, it would be very much isolated to that small group of people. We had a search, shower, and changing area. So on the unit, at the exit, right down the stairwell, before they would leave, they would shower in that area, remove their clothing, go down the steps, and then change and leave the area, so that they never had to worry about potentially contaminating somebody at home. We had a private area, a lounge. So the unit itself is 14. Actually, it's 15 beds, but we took one resident room offline, and we made that a staff lounge area, knowing that they would be spending a lot of time there. And we stocked it every single day with beverages, food, TV. We put cell phone chargers in there, anything to make them comfortable in this very long, and we had no idea it was going to be this long, but this is a very long time period. And then, of course, we provided them with meals, because we did provide an anti-space so that we could, when in need, exchange equipment, medicines, anything we need to in an anti-space, so other people in our facilities could open the door, put it in the anti-space, and then they can come from the other side and receive it and take it back out. So that would be what we had. And we had a very good response. We were able to adopt staff immediately. They stepped up. They filled the unit as actually much faster than what we anticipated. So also on the transformation of the unit itself, the unit is 14 private rooms. Every room had a private bath. Now on the exact opposite side, we found that we had our COVID unit set up, and then 1 week later, we decided to mirror that exact same thing on the other side. So now we really do have 28 beds for COVID residents, but we're still acting as 14 currently. Thank goodness we haven't had to exceed our 14 beds to move them into 28, but we are ready for any second surge this fall. I told you we took one room offline. So we do have negative pressure machines, and I know that is not the most beautiful design for all of you in this wonderful healthcare design space, but you can see the temporary need was outweighed way more than the beauty at this point. So we had partnered with a construction company, Landau, that we were working with on another facility at the time, on a project, who could not have been kinder and donated all of these negative pressure machines. They built our ICWA walls. They were there in 24 hours with all the materials, and they were able to put this space together for us that quickly. So just some of the other things that we did very quickly, we had to get additional med carts. We had to get additional equipment. Every room was isolation. And one of the biggest things we did very, very quickly is we moved to telemedicine, and that was key. Now, we had already been piloting telemedicine at one of our facilities, so it was very easy for us to quickly adopt this. Of course, we had to get our physicians on board, because I told you earlier, we no longer allowed physicians or any providers in our building, but we still had to provide care. So we flipped over to telemedicine, and that's how we were able to do that. Next slide. I put some pictures together. Now, I know these aren't the most beautiful pictures, but they'll give you a sense for what inside the COVID unit looked like. What the first picture you're looking at is everybody being tested for their P100 masks and their N95 if that P100, for whatever reason, did not fit them. So every employee got tested for their masks. And the next picture is the anti-space. So there's the ICWA wall with a negative pressure, and on the other side of where I was taking the picture is the other wall. The third picture there is a self-screening station. So any employee coming into the space had to self-screen themselves. They had to take their temperature every day. They had to answer the questions every day. They had to monitor themselves. But in our other facilities, somebody else does that for them. But in the COVID unit, they were responsible for themselves. Also in that space, this is the shower area on the far left in the scrub service. And we quickly got a service running up in that unit. And the middle picture is everybody's mask with their name on it. So there was a hook put on the exit of the door. So when they're done for their day, they put their P100 masks in there, they clean them, they put them in that bag, and they're ready to use when they come back on their next shift. And lastly, this picture on the right was when we were in, and we were fortunate enough not to be in a PPE crisis at Vincentian, but if we were ever to be in a PPE crisis, we were prepared to not share as individuals, but you reuse your gown in that shift period. So we put hooks on every resident's room where you would take a gown at the beginning of every shift and put it in every room. And as the nurse for that shift, you would just keep reusing that gown in that room if you needed to it every time. It's a little bit awkward because when in infection prevention, when you have a unit that does not have COVID, you behave one way, but when you have COVID, you're behaving the complete opposite way. So it's just something to think about. Next slide, thank you. So I just wanted to tell you real briefly, because I know we're probably extending past our times because Michelle and I love to talk. So we love to talk about what we do, I should say that. I just wanted to give you a little bit of information about the reaction that we got, because there was a lot of mixed feelings about the COVID unit. Our residents, I think our residents overall were very frightened, and they were, over time, you can imagine how lonely this experience is for them. They've been cut off from the world, and they only get to see our staff and our caretakers. We did a lot to connect them to the world. We did, we brought tablets in, and we did 8x8 blocks with their families, and we did regular routines to try to connect them with their families. But we also stopped deliveries, and we didn't allow things in the building. And but we had to make sure. And quite honestly, our outcomes were great. We went universal testing, 6 buildings. We had 0 cases of COVID. So, it all worked in our benefit. Our family members, most of them were very appreciative, but we also had some that were very angry with us for doing a COVID unit and potentially inviting people from outside the community into a building. And I completely understand their position, but I also understand that it is our mission to care for our senior population. And it was our mission to care for people that were ill, that were still in our population, and we were able to do so. But once they understood the isolation and all of the measures that we took to make sure that the area was separated from all of our other residents, they felt more comfortable about that. Our community and our community partners really stepped up. Like I said, our construction company, our physicians, our pharmacists. There were anybody we called, people stepped up. It was like real unity to make this happen. And our colleagues, we have, unfortunately, we do have some state homes and some homes that really did have major breakouts, and we have been able to be there for them, which has been wonderful. If they've had an outbreak, we've been able to take their residents and bring them into our COVID unit and care for them. So we have really strengthened bond, I would say, across Western PA when it has it. And again, this is our mission. We are a nonprofit, we are a Catholic institution, and our sisters, the diocese does not run us. We are affiliated with the Sisters of Charity of Nazareth, and this is one of their many missions from around the world. And, this is what they want us to do and what we want to do. So, but that is sort of how it was a mixed bag of feelings and how they perceived what we were doing. More. So I just wanted to say one of the outcomes of this that was a little unexpected is one day we were at the COVID unit and we got a call, our marketing PR guy got a call, and our Western PA, and this was Allegheny County. This was our local police. This was police all over the Western PA area. Like they literally submerged on our building, and they had signs and candy, and they did this whole police parade. I think there were 55 police cars, fire trucks, ambulances, and they all came in and they did a drive-by for the COVID unit staff, and thanking all of our staff for taking care of the residents of McCandless, which was so sweet. It literally gave me chills to hear it. I videotaped it, but if you would have heard me like thanking and screaming and crying, it was obnoxious, so I didn't want you to hear all that. So I just took a still, so you didn't have to hear me being obnoxious. But so that was one of that. Just the last slide is really just the outcomes of where we are today. We've had 73 admissions in our COVID unit. We've had 66 discharges, at which 66 of those residents have gone home. And this is senior population, so we're very proud of that. And unfortunately, we did have 7 deaths in our unit, but so very, very good outcomes as far as we are concerned. We're very happy with that outcome. So that is it. I do want to thank you all for allowing us to talk. Oh, I did want to mention very quickly, Pennsylvania has formed these regional response health collaboration programs known as the RICPs. And we, as I mentioned before, are standing ready for the surge that is anticipated here in the fall. And we basically have held a unit waiting for any surges that would happen so that we can accommodate any COVID-19 residents that may or may not, hopefully may not, happen in the next several weeks. So that is that. So do you have any questions for Michelle or I?
Let's see, you folks, the comments, I don't know if you've been able to read the comments that have been coming in, but really supportive and really positive. I mean, I got chills so many times when both of you were talking. So it really is quite an inspirational story. I know I have some questions, but we are short on time, so I'd love to open it up to folks. Do you want to stop sharing your screen right now, Michelle?
Sure.
And that way we can see folks who might have questions.
Oh, yeah, there we go.
Okay, thank you. Anybody have any questions for Patty and Michelle? It's just such an inspirational story. Please feel free to unmute. Yep, Kim?
So my question is for the second presenter. I forgot your name already. I'm so sorry.
That's okay.
How transferable do you think what you've done in the skilled facilities, would that be in an acute setting like a hospital setting?
It's actually pretty easy outside of having a unit that has to be removed from the rest of your patients or your residents. So you're, at least from our perspective, having that isolation and that building being separate, somewhat separate, is what I think gave the comfort to the family and the residents that it would not spread. The unfortunate part about COVID-19 is once it's in your building, it's in.
That's true.
It's very difficult to stop it from spreading. So since then, like I said, we had 6 facilities. We've done our universal testing. We had a 0, and then one of our facilities, which is in the South Hills of Pittsburgh, had an employee come in that had tested positive for COVID and gave it to, we're going to assume, because we don't really know, that one of our residents then tested positive shortly thereafter. And that starts the ball rolling. We were able to, what we ended up doing and learned very quickly, we moved residents immediately to our COVID unit. And then when you realize that you have an outbreak or a cohort, you shut down that unit. So we immediately shut down that unit, but we still didn't have the same success as we do in our COVID unit. And I think it's because, one, it was still a shared building, shared spaces. We didn't have negative pressure machines. So for as much as we tried to isolate that unit, it wasn't as successful as our COVID unit.
Understood. I have the privilege of, I'm saying that we're loosely, of managing 14 hospital, a Franciscan health system as well, that I get all the COVID craziness coming to me. So how are you dealing with all the sometimes for me, it feels like there's a disconnect in the communication and what should be done to help keep your patients and your residents safe. How are you personally dealing with how to react and respond and still feel like you're on top of things with the COVID and how you should manage it? Because I feel like I'm drowning half the time.
Oh, yes, I get that. I would honestly tell you that COVID command team has been key to our success, because the team, every morning at 8 o'clock, we get on a call and we sort of, okay, here's what we need to do today. We heard, that our frontline staff doesn't understand XYZ. Let's get that communication out to the frontline staff. It's really about the communication piece of what we're receiving in and how we're disseminating it out. I mean, maybe too much information for you again, but what we have learned is the negative of that is now there's a dependency on us to disseminate. So it's at the point where we're like, listen, we can't spoon feed this to you all the time. You're going to have to take some responsibility of gathering that information. But in a crisis situation, it really worked. And then we had every day during like the height of it, we had 3 o'clock calls with a larger group of people that we took what we learned in the morning and disseminated that information in the afternoon.
I think that's interesting that you said that, but maybe I can chat with you offline. I don't want to hog all the questions and stuff, but maybe I can reach out to you for questions that I have in the future.
Absolutely, absolutely.
All right, thank you. Thank you again, both of you all. Great presentations. Got goosebumps just listening to you all. It was amazing.
Aww, thank you.
Really amazing. Thank you, Kim. Any other questions, folks? We are a little bit over our time, but it seems so worthwhile to be able to take the opportunity and ask any questions that you might have of Patty and Michelle. I think we have time for one additional question, if anybody has one. Well, I want to say thank you so much for sharing your story. I'm looking at you both smiling, and I'm wondering how you've held it together through all of this. It does sound like you've had a tremendous amount of support from the community, and I'm sure that helps. But it sounds like you really have taken care of your staff. So that balance is just going to be so challenging. For me, listening to, here's a quick question. How have you been able to maintain that intergenerational program and protect against COVID?
Very, very interesting story. That's good. It did morph a little bit. We had a student who was a traveler and had to quarantine. We originally had 11 students come into Shenley, and their program morphed and they had to stay home. So we have 8 students there now. So there were a lot of adjustments to be made. And the fact that their student area is isolated from the residents at Shenley was certainly an issue as well.
Wow. Yeah. I mean, because certainly the benefits of that are so tremendous. And that's such a wonderful program. And even the fact that you've got the daycare, on site. And are you still maintaining that? All of this?
Early on in our childcare, we did close childcare. We have a freestanding childcare, and we also have a childcare that is in the first floor of one of our skilled facilities. So our childcare that's freestanding, we closed the other one also. We have not reopened the childcare that is in the skilled facility. And as I mentioned to you earlier, Lynn, we are in the process, we're taking advantage of this time to remodel that entire space. And as part of that remodel, and you might find this very interesting on the call, that as an organization, we are now talking to architects and construction companies about what does this mean to us in the future? Do we need separate HVAC systems, or should we be looking at ionized, air? Are we looking at UV? What do we need as far as systems to make sure that people are more comfortable about putting their children in the same building as residents? And the design of the building is a little bit different, and how we're moving forward will change us forever.
So, That's something actually, you know, I think I mentioned to you, the FGI guidelines is looking at all of this, and they're working on developing an emergency response guidance piece for the industry and to really to, you know, respond to issues just like that. So I'll make sure that I keep you in touch with what's going on there. And I see that Jane is on the line. Jane, I know you're involved in that report. I don't know if you have anything additional to share on that.
Sure. The great presentation. You guys give me so much hope for how things should be handled, because the opposite is true and for many of my clients. So I really appreciate you guys very much. And I love your intergenerational modeling, because that's where my heart is, as Lynn knows. So the FGI has been working on emergency conditions, and the white paper is in its final review and should be published. We were hoping before the end of the year, but if not, the very beginning of January. They're going to use that white paper information to actually establish a full guideline on emergency conditions. And I looked at the review of it because I'm doing a presentation for Florida for ACA this week, and they have a little brief summary of when things are coming out and what's been addressed. And many of the items that you've put in have been addressed. There's also a new ASHRAE document that hasn't been posted yet, but the work has been completed on it. That includes not just the ventilation and filtration and now the aerolization of the virus, but it also includes cleaning and disinfection information in terms of surfaces and degradation as well as efficacy.
Oh, that would be wonderful. Thank you.
Yep, we'll make sure we stay in touch, and I'll get you updates on that. But Jane has been very involved in that. So we are over time, but well spent, inspirational, informative, amazing that you were able to get so far ahead of everything. You've got to have the insight that it took for you to do that, Patty. I mean, it's pretty amazing. So congratulations to both of you and to your entire organization for the wonderful work that you're doing. Thank you for sharing your story. I definitely want to stay in touch, and thank you to everyone on the call for the work that you're all doing. I know that, we're all involved in this in slightly different ways, and it's hard. So we got to keep smiling and keep working through it. And so thank you, everybody. Have a wonderful rest of your day. I did have some additional resources to share with you, but I think I'll do that by email. I'll do an email follow-up. So with that, we'll conclude our call, and everyone stay well, and thank you.